Hello, I'm Ruth Allen, Chief Executive of BASW, and welcome to this vlog. And I'm delighted to be joined today by Morgan Vine, who's from Independent Age. Hi, Morgan.
Hi, Ruth.
Hi. Morgan is the Head of Policy and Influencing at Independent Age, which is a charity working with older people. So, first to come to you, Morgan, just tell us a bit about Independent Age and what you do, where you come from.
No problem. So we are a national older people's charity. We provide services to people. So we have free information and advice service. That includes information on our website, paper-based guides and booklets. And we also have a team of advisors who can support people with more complex queries. We've got a team, a friendship service team across the country who provide connection to people who are feeling lonely or isolated. So people get in touch with us and we pair them up with a volunteer, whether that's by telephone or face to face. And we have a policy and influencing team, which is where I am. And it's our job to really listen to the key issues that are affecting people in later life as they grow older, and what we can do to change and improve the systems that they rely on. So working with the government and the NHS and others to try and make sure all those systems are more fit for purpose than they are at the moment.
Thank you. It was great to make contact with you. Some months ago in BASW, we wrote out to lots of adult social care organisations across the UK, including ones that we didn't know so well, to make contacts and find out where we might have, things in common and agendas that we could share and to start conversations. It's great to be able to make contact with you. Could you say a bit about how you differ from some of the other national older persons charities?
Yeah, so I mean, we work really closely with lots of other organisations in the sector, both those who represent people in later life, but also people with long-term conditions or disabilities, because we know a lot of the issues that affect the people we support are the same and, need urgent action. I think at Independent Age, we try to spot where there might be less of a conversation about things. So, for example, we're doing quite a bit at the moment on older people living in poverty and people who are on lower incomes, because we think that that's maybe a gap at the moment that less people are speaking about. So we try where possible to use our resources to make sure that we're focusing on things which others might not be.
Yeah, no, and I think that's come over in some of the conversations we've had and looking at some of your campaign areas. Are there any particular campaign areas that you're working on at the moment? And I guess, we're all thinking about the experiences we've had through COVID and where we're coming out of this as well. So how that's influencing your work in your campaign areas.
Yeah, so I mean, sadly, as I'm sure you and your members will be well aware, I think COVID's made life a lot more difficult for people. So the things that we were campaigning on before remain important, but we're tweaking them and twisting them to sort of react to the pandemic as it's happening. So as I mentioned, we do quite a bit on looking at older people who are living in poverty or don't feel financially secure. And we were doing that before the pandemic, looking at things like pension credit, which has an incredibly low uptake, but people really need that money in order to heat their homes and put healthy food on the table. With the pandemic, we're hearing more and more from people who are really worried about their money and their outgoings. So we think pension credit is even more important, particularly with rising costs. For example, fuel bills are likely to be going up with people staying at home more in the colder months.
Yeah.
We're also doing quite a lot on access to treatment. So as you know, we released a mental health report called Minds That Matter that was looking at people's mental health, how they access treatment, how they're supported to get the help that they need. And we're also about to do a delve into physical health as well, and thinking about the treatments and the physio and the rehab and things like that people need in later life, and whether they're able to access it and what barriers might be put in their way that we could help knock down. Social care is obviously a huge one that I'm sure your members are completely familiar with, but many of the people that we speak to talk about the failings of the social care system in terms of, facing catastrophic costs, having lacking continuity of the professional carers that they receive, it being very complex to navigate. So all of those are things that we as a charity look at. And the other one which has come out as part of the pandemic, which we were looking at before, but I think it's really hit home what a massive problem this is bereavement support.
Yeah.
So, we did some number crunching after the first lockdown and worked out that 98,000 people over 65 would have lost a partner during that lockdown. Now, some of that would have been directly because of COVID, but for others, it might not have been COVID that caused the death, but they are experiencing that grief and bereavement process during a pandemic where they can't be with their loved ones, they can't have a funeral, they didn't necessarily know the death was coming. So we think bereavement support is going to be really key to coming out of the pandemic too.
Yeah. Do you have any thoughts about what that needs to look like? As a society, we're going to be emerging through a time of great bereavement and great loss. And obviously for older people, disproportionately affected as older people with their partners, with their families, illnesses themselves, if they've survived. But what have you got thoughts about what's needed?
Yeah, I mean, we've had early thoughts. So at the moment, as I'm sure you're aware, people who live in Brighton might be able, for example, to access bereavement support through the NHS or through their local council. Whereas if somebody lived in Bognor, and these are just hypothetical locations, they might not have any access to bereavement support. Whereas somebody who lives in Coventry might have bereavement support provided by a charity. So
Yeah.
we don't think it's right that your location dictates what support is available to you, and we think there needs to be like a more national approach to bereavement support, finding out how local authorities and CCGs fund it, how they measure what the need might be in their local community, and how they provide the support that's needed. I think there's also something about signposting, you know, for health and care professionals. Often you might be the first port of call that somebody comes to when they've been bereaved, and they might need bereavement support, but there could be other things too, like they might be entitled to pension credit at that point, for example. So I think signposting is really, really important too from professionals.
Yes, I think absolutely. The fact that professionals in all sorts of helping and supporting roles will be dealing with people who are bereaved or have had other kinds of traumatic experiences through COVID, that's going to be, I mean, it currently is something that's happening. It's happening all the time in public services, and that's going to continue. And obviously with something like bereavement and loss, it doesn't necessarily hit immediately. So
No.
it's something that people carry and need to maybe talk about at different points in time. So I guess some of your thinking is about what's needed for not just in the next months or even in the next year, but maybe longer term as well for older people.
Yeah, I mean,
Yeah.
a lot of the professional organisations like Cruise say that, you know, it can take up to 6 months to recognise the bereavement and the grief and to feel if you need professional help. But we're hearing from a lot of people who have been making comments like, I'll just wait until the pandemic's over. I'll grieve once it's done. They don't want to bother health and care professionals with their grief because they feel they're too busy, which, you know, because of the pandemic, not because that's what health and care professionals are telling them. So I think there's going to be an even bigger situation of delayed grief, which is definitely going to be something that has a real overhang for many, many people.
Yeah, and I guess I know that you do surveys and you engage with older people in that way. Are there other ways in which you actually work with, as an organisation, you work with your constituency, if you like, you work with older people and hear what they're saying?
Yeah, so in the policy team, we speak regularly to our colleagues on the advice line and the helpline, and we get information from them about the calls they're receiving and what the key problems are that people are facing. We also have a campaigner network, which is at the moment about 20,000 people, many of whom are in later life, and they share their thoughts and opinions with us. So, for example, in the autumn, we did something about how COVID was impacting, and about 5,000 people responded to that who were over 65. Our mental health report had about 3,000 respondents to a survey. And we're also setting up individual groups of people to feedback on things. So, for example, we've got about 300 to 400 older people who have agreed to answer regular questions on COVID at the moment. So each week we're going out to them and saying, you know, what's your experience of the vaccine? Have you received communication about the rollout, etc.? And they're giving us really timely feedback, which we're then able to feed into the Department of Health and Social Care and the NHS to try and make sure they know what problems are there and they can address them.
Great, thank you. That's really interesting. I was also wanting to ask you about how independent age and the people you work with and the services that you have, how you work with social work and what's the kind of profile of social work and any asks, I guess, about where does social work need to go in relation to older people and perhaps particularly coming out of COVID?
So I think some of the key things that we hear a lot at Independent Age, so we have lots of resources to help navigate people through the social care system, for example, to help them understand what an assessment would look like, that they could ask for a carer's assessment, that they can have an assessment for social care themselves if they're living in their own home or a care home. So we guide people through that process. But I think one of the biggest things is just how complicated it is. And for many people, they're reaching the need for social care in a moment of absolute crisis where they've waited until the very last moment, or their partner has tried to care for them and cope right up until a point where that's just not feasible anymore. So I think one of the key things from us is just trying to make sure as many people as possible have early intervention, that they know what their options are, that they know that, you know, social care professionals are there to support them and to help them remain as independent as possible. You know, I think there's definitely a misunderstanding around when you would contact a social care team, and how they can help you. And I think that's something that is really, really important. And also for the professionals in social care to just be signposting, for example, different benefits or carers assessments, which we know that many people might not actively put themselves forward for, but it can be so important.
Yeah, no, absolutely. And I guess one of the concerns will be, again, coming out of COVID and coming the other side of it, is whether or not people have missed out during that time, things that haven't been available, which is, we hear from our members the frustrations and worries and concerns about not being able to see people, not being able to sustain continuity of contact, or you know, and actually organise services. And many provider services, of course, haven't been there. But I mean, I guess that comes through to you. That's been coming through to you during this time.
Yes, absolutely. And, you know, it's a very worrying time for both the people who need care and also the people who deliver care and who organise those packages and do those assessments. I mean, we have heard worrying situations where older people have felt unsafe to have to receive care in their own home, for example. So they've paused their care package and they're now really, really worried about that being taken away for good, or people thinking they didn't need it in the first place. But, you know, the people we're speaking to, they're washing themselves with the flannel in the sink, so they still need that care package. They're just managing while they feel that the pandemic is so rife. So I think one key thing is making sure that those care packages are reinstated as soon as they can be safely.
Yeah, and I think I would balance what I just said with all that we're hearing about people trying so hard to maintain services, find different ways of delivering them, and also to be gearing up to being able to restore services, and maybe to have learned something about how, you know, other parts of the community groups and so on can also support formal care. So it's been such a difficult time, but we also know that people have been quite ingenious. A lot of organisations have been incredibly ingenious.
I mean, we've actually, you know, we've spoken to people in later life, you know, older people make up a huge section of the volunteer workforce. So, you know, we've spoken to a lot of older people who, before the pandemic, for example, were running carers clubs where people with caring responsibilities could go speak to others in the same situation, get advice. Sometimes they would have guest speakers. And, you know, all of those things are on pause at the moment, and they're trying to find other ways of engaging, you know, ringing people and doing things online. But I think that face-to-face contact is being hugely missed by many.
Yeah, no, absolutely. Well, and of course, lots of people have taken up a vaccine, and we're hoping that that's going to be transformative. It's not the only answer to the situation we're in, but that's a massive thing. And it's been fantastic to see huge uptake in most parts of the country from older people. Morgan, that's been great. It's been lovely to talk to you today. Thanks so much. It's an Independent Age, really interesting organisation doing lots of fantastic things across the UK, I think. Is that right?
Yeah, that's right.
Yeah, and you've got lots of advice and signposting information on your website. So thank you very much for joining me today. Thank you. Bye-bye.